Hello and good day. We are going to talk about medication administration. In order for any person to do the initial certification for new medication technicians, the applicant must complete a board-approved medication technician training program. You must complete a medication technician application, including submitting 2x2 passport size photograph and paying a $20 initial application fee. The person must be at least 18 years of age to apply for certification as a medication technician. The application must be signed by the RN, approved to teach the medication technician program. The board will certify the eligible applicant and issue a medication technician certificate. Should the medication technician change practice settings, the employer is responsible for assuring that a RN approved to teach the medication technician training program specific to that practice setting teaches the medication technician course content specific to that new practice setting. The initial CMT certificate will be effective until applicant's next birth date. This may be less than 2 years for the initial CMT certification, or it could be within the 2-year range. For example, if the individual CMT certificate expires September 28, 2023, the individual would need to complete a CMT clinical update sometime between June 28, 2023 and September 28, 2023. Now, CMT will renew the certificate every 2 years following the date of the first renewal. Certification will expire on the 28th day of the individual birth month. An individual born in an even year will renew in an even year, and an individual born in odd year will renew in the odd year. The board will mail the application, email you the application when it is expiring, but many a times it is important for us to know when our license expires and when we should renew it. So it's important for us to make sure that we stay on top of our expiration dates and renew them 90 days before the expiration date. Again, it must be the CMT training must be completed by a delegating nurse approved by the Board of Nursing, and you need to have the renewal fee, the clinical update classes or 4 hours update class, and you must pay a $30 renewal fee to the Board of Nursing. The board will electronically match the clinical update verification and medication technician renewal form and make sure that it's clinically updated. Now, if for some reason, if your license is not updated, when you have renewed it, you must contact the Board of Nursing. Maryland Medication Technician Training Program meets the federal and state training requirements of a CMT in the state of Maryland. The program is at 20 clock hours through lectures, role-playing, group activity, practice, and the students will learn the objectives of the medication administration training approved by the Department of Education and Maryland Board of Nursing. This video is an additional to 20 hours training to be used as a quick reference. Again, the objectives are making sure that medication administration and medication technicians role, different uses of medication, medication standard and regulation, observing the physical and behavioral changes, responsibilities when assisting in a visit to a healthcare professional, basic medication responses and interaction, forms of medication and routes of administration, correct storage procedures, how to use the references and the resource manuals, and the materials and procedures for safety administration medication, and documentation procedures will be included in part 2 of the video. The pharmacological concepts that you need to be aware of are drug names, the classification, medication forms, or preparations. Again, the legislation and standards of MedTech program is being guided by federal regulations, state and local regulations, healthcare institutions and medication laws, and nursing practice. We need to understand the pharmacokinetics of the medications, and let's talk a little bit about absorption. The absorption of any drug depends on the route of administration, ability to dissolve, blood flow to the administration site, body surface area, and lipid solubility. Again, the medication depends on the distribution, which means the circulation, membrane permeability, and protein binding. Metabolism of the drug can be related to the biotransformation and deoxification. Excretion from the kidneys, liver, bowel, lungs, exocrine glands. And also, we need to know about the therapeutic effects, side effects, adverse effects, and toxic effects. The actions of the medications also includes idiosyncratic reactions, allergic reactions, interactions, medication dose responses. Now, taking a look at routes of administration, orally, you could give it by mouth, under the tongue, sublingual, or buccal, parenteral, which means intradermal, which means under the skin, subcutaneous means under the subcutaneous tissue, intramuscular is in the muscles, and intravenous is into the vein. Topical is application on the skin or local administration. Inhalation is something that you are inhaling either through the nose or through the mouth. And intraocular is through the eyes. Now, systems of measurement, metric, grains, household, again grams, milligrams, kilograms, liters, milliliters, and so on. So many different metric systems are available for the medications. Again, there are some medications that, especially liquid medications, can be given 1 tablespoon, 1 teaspoon, 1 ounce, cups, pins, quarts, etc. Now, clinical calculations. You're not required to calculate. Usually the pharmacy will be calculating the amount or the amounts to be given for the resident or the patients. But for example, conversion is, the formula is simple. Dose ordered, okay? Dose on hand. So dose ordered and what is on your hand. So dose ordered divided by dose on hand times the amount on hand. Again, 1000 ml is 1 quart, 2 tablespoons is 1 fluid ounce, 30 ml is 2 tablespoonful, 1 tablespoon is half fluid ounce, 30 gram is 1 ounce, 1 tablespoon is 5 cc, 1 gram is 15 grains, 30 ml is 1 fluid ounce, 60 milligram is 1 grain, 3 teaspoons are 1 tablespoonful. Prescriber's role, types of orders. There are so many different types of orders, which could be standing orders, PRN orders, single orders, stat orders. Distribution system. The medications can be distributed to the assisted living facility for a particular resident as a stock supply or a unit dose or computer controlled dosage system. There are 6 rights, and CMTs need to be aware of the 6 rights of medication administration. triple check before administration, client assessment before administration and after administration. The 6 rights are right medication, right dose, right time, right route, right client, and right documentation. The clients have the right to be informed of what medication that they are taking. They have the right to refuse medication. They have the right to be carefully assessed and monitored before and after the medication. They have the right to get their informed consent. They need to also make sure that medications are administered safely, supportive therapy, and they need to be aware that they are not getting any unnecessary medications. Now, it is important for a medtech to watch out for medical history. You need to be aware of what is exactly happening to the resident. History of allergies, medication data, diet history, perceptual or coordination problems, if there are any current conditions that are disturbing the resident. Attitude about medication use, knowledge of therapy, learning needs. The nursing diagnosis, especially the delegating nurse, will have to assess if the resident is knowledgeable about the medication or if they have any deficient knowledge, if they are non-compliant with medications, if they have disturbed sensory perception, impaired swallowing, ineffective therapeutic regimen management. Those needs to be monitored and they would have to call the physician. But if there are any changes, it is the responsibility of the CMT to monitor and let the delegating nurse know. The goals and outcome will be, after planning medication administration for the resident, the client will verbalize therapeutic and adverse effects of the medication. It is important for you to set the priorities and continue the care of patients so that no harms are, there are no harms for residents who are on any type of medications. Client and family teaching is important. Medication orders, receipt, transcription, communication is important. Calculation and measurement, correct administration technique, and recording of the medication administration. Special consideration for older adults. We need to be aware that residents who are on too many medications, which is called as polypharmacy, self-prescribing, some of them would take their own medication without healthcare providers' knowledge, over-the-counter medications, if they are misusing any medications, and if they are non-compliant with any medications. The CMT must monitor for client response to medication and client and family's ability to understand the ability of the patient to take their medication. If they are taking medication or by mouth, you need to make sure that there are no GI alteration, gastrointestinal alterations. If they have the ability to swallow, if they use the gastric, if there are any gastric suctions being used, positioning the resident, and so on. Skin application, use of gloves or applicators, preparation of the skin, thickness of the application, and again, all these type of medication administration competency must be evaluated by a delegating nurse. Nasal drops also must be, you have to be aware of positioning the patient and making sure that the delegating nurse is checking and evaluating for the competency, and delegating nurse has to delegate the responsibility to CMT. Eye drops, ointments, assessing the eyes are very important before and after the drops. Make sure you're practicing infection control guidelines, positioning the resident, and again, these type of medications must be monitored. Competency must be evaluated and approved and delegated by the delegating nurse. Assessment of ear medication applies to the same principle of nasal or eye drops. Suppositories, again, this has to be also monitored by the delegating nurse, and competency must be evaluated on a case-by-case basis and must be approved and delegated by the delegating nurse RN. Medication used to wash out from the body cavity, sterile water, saline, whatever it may be, it has to be, again, competency must be evaluated by the delegating nurse RN, and she should be overseeing the administration. If there are any type of parenteral administration, including IVs, they are not permitted in the assisted living units. However, if the patient is directed by a home care agency and a home care agency comes in, then they may be able to have those treatment methodologies provided by the delegating nurse or the registered nurse from the skilled nursing facility or the skilled home care agency. Insulin, if you're administering insulin, again, the delegating nurse must be monitoring and evaluating your competency prior to you doing them individually or independently, and it must be approved and delegated by the delegating nurse RN. Subcutaneous injections, the same thing. Again, if there are any type of injections that needs to be provided to the patient in an assisted living facility, the delegating nurse will have to check, monitor, do a skills and competency evaluation, and it has to be on a case-by-case basis just to make sure that it can be delegated by the delegating nurse RN. What determines if a resident can self-administer medication? A complete assessment needs to be performed by the registered professional nurse, delegating nurse, and self-administration of the medication is just one way for the resident to maintain his or her independence in assisted living facilities. What is the duty of the medication technician? Now, medication technician should administer the prescribed medication to the patients and provide support to the nurses and healthcare professionals. A short list of medication technician duties includes offering medication to the patients, performing basic medical checkups, providing patient care, updating records, and filing in the forms. Also, making sure that the residents are being taken for an appointment, following up, refills, and also making sure overall the physical condition of the resident and the mental health of the resident is able to be managed well with the medications that they are prescribing. Again, the CMT classes will be held via Zoom or in person, and the first 3 days of the class would be online and the last date will be in person. Quiz, there will be a couple of quizzes. I just want to do a couple of quizzes with you with this video presentation. Amoxicillin is an example of which class of medication? It's an antibiotic. Estrogen is an example of which class of medication? It's a hormone. Yes, it's a hormone. Nexium or Prevacid are examples of which class of medication? Yes, it is a gastrointestinal tract drug, GI medication. Which medication is an example of cardiovascular agent? Yes, it's Lanoxin, digoxin, and make sure to check your heart rate, check the patient's heart rate before you administer the Lanoxin, and do not administer it if the heart rate is less than 60 or more than 110. Which medication is an example of respiratory tract agent? Yes, albuterol. Ensure is an example of? Yes, nutritional supplement. Which is not an example of topical medication? Syrup is not. Cream, gel, and ointments are considered as topical medication. Which of the following statements accurately describes a medication on the controlled substance list? can be dispensed without a doctor's prescription or resident signature, will not produce unwanted effects, they may be purchased in stores other than pharmacies. No, these medications require special storage and reporting procedures. Yes, that's the correct answer. Which of the following statements about over-the-counter medications is false? They may only be dispensed with doctor's prescription? No. Please watch Medication Administration Part 2 video for further details. And for questions, please contact me at joynewbegin@gmail.com. Have a good day. Bye-bye.